In the large field of people who study and make recommendations about how to address physician well-being, there's one name that stands out as the individual who has been thinking about, researching, and impacting physicians, their families, and healthcare systems the longest and arguably with the broadest reach. I'm referring to my guest today, Dr. Wayne Sotile, a psychologist who's been an international thought leader on physician behavior and resilience for over 45 years. Wayne consults widely with medical group practices, healthcare systems, and corporations interested in promoting team engagement and resilience while coping with change. He has authored or co-authored 10 books on the subject, including Thriving in Healthcare, a guide to choosing resilience over burnout in your busy life, as well as many others. He's also published widely in the peer-reviewed medical literature, including featured articles in JAMA and Mayo Clinic Proceedings. Dr. Sotile has delivered more than 8,000 invited addresses and workshops to medical audiences from 65 countries, and he's been featured in appearances on Good Morning America, CBS This Morning, Dateline NBC, and more. In short, Wayne is a rock star in the physician well-being world, and I'm fortunate and delighted to have him on the Life Changing Moments podcast. In this jam-packed conversation that I had with him, you'll learn about the biggest stress in physicians' lives. Spoiler alert, it is not the electronic health record. The best predictors of physician well-being, career satisfaction, and relationship quality. The fundamentals to attend to build individual resilience and well-being. We'll hear about what Wayne calls the 4 Ps. And for those looking at the big picture of healthcare in general, we'll hear Wayne's 4-winged bird model for improving the well-being of healthcare professionals, and much, much more. Please stay with us. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life Changing Moments. So, Dr. Wayne Sotile, welcome to Life Changing Moments.
Thank you, Dr. Waxman. It's an honor to join you.
So, Wayne, we've known each other for a while, and you are a nationally and internationally recognized expert on the emotional health of healthcare professionals. While I've learned a lot about you over the years by listening to you, and then we've done a little bit of work together collaboratively, aside from your tales of your relatives and growing up in Louisiana, which for anybody who hasn't heard them are quite entertaining, I actually don't know a lot about you, specifically your professional path that has resulted in helping out thousands and thousands of healthcare professionals. So how did you get to psychology in the first place?
I was in pre-med, Louisiana State University. Good old boy from LSU, went in dumb, came out dumb too. Yes, the song from famous song says. I was in pre-med at LSU, and I ran into my high school chemistry teacher who enrolled at LSU when I graduated from high school. He went to LSU to get his PhD in chemistry, and he was this charismatic, eccentric guy. And he said, "Sotile, what are you doing?" They always called me Sotile. I said, well, I'm in pre-med. What kind of grade? I'm making good grades, but I really don't like it. I don't like, you ought to be a psychologist. Here's what he told me. You've been a psychologist all your life. And I realized how true that was. It just felt like going home. I switched to psychology, and it was just, I felt like coming home. It just came very naturally to me to do psychological stuff. So I ended up, I got a PhD in clinical psychology, and I specialized in what then was called medical psychology, because I was always interested in the psychology of medical care. It's now called clinical and health psychology more universally. And as part of that, faculty had medical school at Wake Forest. That was my first job. And while I was there, we developed the field of cardiac rehabilitation as it is now known, multidisciplinary approaches to helping heart patients cope. That's relevant on two fronts. One, I got interested in studying resilience, who gets through hard times and comes out stronger and better across medical populations, but then also in general. But then secondarily, I went into practice. My wife and I started our practice in Winston-Salem, North Carolina. I left the factory because it fell apart. And that, in a number of other circumstances, resulted in the physicians who were referring medical patients to me and Mary started, my wife's name, Mary, started coming to see us themselves. And so pretty soon the people physicians and everybody who came along with physicians started to see us. And we, as you mentioned, to date, we've had thousands. We've had over 12,000 physicians and or medical families as clients in our practice. Our daughters now run our practice in Davidson, North Carolina. And we work with thousands and thousands more because I've done a tremendous amount of traveling, speaking, and consulting over the last 40 years with health systems and medical groups and medical specialty societies. So I got into this as a psychologist. So I was interested in psychology. I was also interested in medicine. I was interested in the psychological aspect of medical care, and particularly from a family systems perspective, and enjoyed working a tremendous amount with recovering medical patients of all sorts, but then also really love working with health professionals taking care of patients.
Thank you for that, and sort of that path that led you from medical, sort of the medical environment, to actually having clients who are working through their medical issues, but also their personal issues. And even, I know that you did a lot of work in medical marriages as well, with some of that family background as well.
Well, yeah. And we, I've always thought systemically. You and I were talking about family systems medicine earlier, the merger of the fields of family systems, family therapists, and family medicine. That all began when that movement began, when I was on the faculty at medical school. I sound like Abraham Lincoln, right after the Civil War, when I finished graduate school. It's amazing to think back on that, Dale, how many, that was 45 years ago. And several things are true. People did not think very systemically. I worked a lot with heart patients and was one of the first people to start talking about heart illness as a family affair. Well, so is cancer care, so is everything care. It doesn't just impact the individual. Similarly, we realized somewhere along the journey, let's use physicians as an example. We're coaching and counseling physicians who really get it and change, but then they go back and they're working in dysfunction, or they're living in a family that's overstressed. So then we draw a circle around the physician. We've got to work with the personal family system. And we did a tremendous amount of work with medical family. We wrote a book on medical marriage. The American Medical Association, the American Medical Association Alliance, specifically sponsored us doing research on medical families. We just actually updated a survey. Tate Shanafelt and I resurveyed physician spouses about what life in medicine is like now. And so I've been, over the last decades, have remained active in examining medical family life. In a punchline here is coaching and counseling, just as in addictions recovery. You got to involve a family systems component, engage in a family, if you're going to have stickiness for change. One person can't go on a budget. The couple's got to go on a budget. If you switch contexts and mix my metaphors here. So we have been fascinated by what has remained the same, what has changed over the decades in medical family life. In our national surveys, and we've done a number of them in peer-reviewed, published them, we survey physicians from residency or training through retirement, but we also survey their life mates, however they define their committed life mate. And it gives you another portal of entry of influence into a physician's life, but also insight into physician's life. Now, the concentric circle metaphor continues. We also realize medical families and physicians in those medical families, or health professionals in the don't do well, don't sustain well-being unless they're working in functional groups that are practicing in health systems that are or making the work doable. So our career expanded from working with medical patients to working with the people taking care of the patients to working with the families of the medical professionals to working with the groups in which the medical professionals are functioning to working with the health systems in which those groups are credentialed. And it's been just a magnificent career and privilege and honor to do that work.
Wayne, you just did a really lovely description for people who don't know what we mean by systems, thinking in terms of systems, those concentric circles, your career evolved along those concentric circles. And that is systems thinking. That is all of the different systems that have an influence on the individual and then also the individual's influence on the system. So that's brilliant. So now I know what you did. Can I back us up? Because I also want to hear something about what did you learn? So specifically in those medical marriages, you're re-looking at some of the data. What are some things for listeners to take away that you've learned about the emotional health, if you will, for a medical marriage?
Well, in medical marriages, as in the study of well-being writ large, what's true is we use the Gallant studies, the 80-year prospective study of resilience done at Harvard. That study suggests that the most powerful predictor of longevity and well-being is quality of relationships. Nothing sustains the capacity to get through hard times and come out stronger, derive meaning from the hard times, have post-trauma growth syndrome from having gone through the hard times. Nothing promotes that more than loving connection or supportive, at least, connection from people who matter for the target individual. The flip side of that is also true. Nothing drains coping energy in all that comes with that drainage, including poor attention to factors of well-being. Nothing drains well-being more quickly and dramatically than does interpersonal acrimony. So we've got some real sobering news now. I mean, in our most recent survey, what we found is that over 60% of life mates of physicians say, I am lonely. And we live in communities that do not support the unique challenges that come with life in medicine. This is a new phenomenon. It used to be that the social compact was you physicians do this heroic work of denying your own childhood and young adulthood to go get medically educated and then go work. And the data are data, take Chanterfeld's data and studies I've been involved in with them, sixfold more physicians work 60 plus hours a week than any other white collar profession we've studied. 22% work 80 plus hours a week. So the work family challenges for medical families are unique. And yet what we're finding from reports from spouses, because physicians tend not to complain, from spouses or life mates of physicians. And I'll only say this once. I'm very passionate about being respectful of cultural diversity. Not everyone's married. So we always ask, do you have a committed covenant relationship with a life mate?
Right.
Life mates of physicians, over 60% say we live and work in communities that are not very supportive of the unique challenges we face. In fact, our neighbors think we live the cushy lives of rich doctors' families and have no idea the sacrifices we make. So there's more loneliness now than 3 decades ago. Secondly, there is more soul-splitting pain about work-life imbalance for today's cohort of physicians and medical families than ever before. In the course of your career and mine, 2 things have happened to reshape the psychosocial, spiritual underbelly of life in medicine. Women have entered the workforce, and family has entered the hearts of men, physicians.
Right.
We first surveyed this in the early 70s. We're doing a review of the literature, and I kind of found, asking the question, are you stressed by work-life juggling? Only 15% of physicians said they were stressed. They weren't. They were all males, and they just worked a bunch. They didn't have soul-splitting dilemmas. It's not that they worked more. They just didn't have work shame. Well, over 80% of physicians, males and females, say the biggest stress in my life now is work-life imbalance. It's an unfortunate consequence of an iatrogenic sequence we helped generate. Those of us who came of age in the 60s and 70s and were feminists thought we were doing something good, promoting the mythical balanced life. If you're a real good person, married to a real or attached to a good person, work with real good people, you, my friend, are going to be the first person in the history of the human race who has a perfectly balanced life. And we set up people to feel new age guilt perpetually. And people do. So we have male and female physicians have aspirational goals to have it all. Yet your work has gotten more complex than ever, less socially supported than ever, more under-resourced than ever, while the expectations of coach the kids team, go to every ball game, go to every practice, all that stuff is exploded. Or my life mate's been waiting forever and we're at a later stage of life and it's time for me to come off call, but there's no provision for me to come off call and maintain integrity in my group. Our survey just showed physicians practicing over 35 years still take 5 days a month on average call. And nothing wrecks well-being more than being on call, anticipating it, doing it, then recovering from it. So one of the things that has changed, is my point, is that there's a new consciousness of expectation. Both men and women, we expect to have it all: meaningful work, good intimate partnership, positive family relationships, and self-time, time enough for, as your brother said in your nice interview, me time, time to do the things that rejuvenate me avocationally, spiritually, and so forth. Yet there are only 168 hours in a week, and we're trying to do all that in the same time frame with elevated expectations of what it takes to be a good male or female person, a good child to an aging parent, a good mother, father, a good life partner. So one thing that's changed is a whole lot more, I call it new age guilt, in the psychosocial spiritual underbelly of medical family life for both male and female physicians.
Today's episode is brought to you by Eagle Financial Group. Eagle Financial Group is here to help you understand your numbers and to make wise decisions. Whether it's fractional CFO services, accounting, bookkeeping, payroll, or tax strategies and preparation, Eagle Financial Group is your partner to ensure that your practice keeps on serving your patients and gives you more time to spend with your family and friends. It's time that you overcome your obstacles and get control of your financial life today. Give Eagle Financial Group a call at 719-755-0043. Drop us an email at clientservices@eaglefsg.com or visit us online at eaglefsg.com. We are a proud sponsor of the MD Coaches family of podcasts.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Wow. So, if it weren't stressful enough to talk about the challenges of being a healthcare professional, and a lot of our focus in the national conversation has been the disillusionment, burnout for healthcare professionals, largely because of all these external factors, healthcare systems and pharma and insurance companies and guidelines and electronic health records. This underbelly that you're talking about is a pretty big deal. And I wonder, Wayne, what are some steps forward to our own emotional health? I realize that could take a whole long conversation. But from this data, with this, we're now mired in a world where there's a lot more expectations on a lot of different levels. You started by talking about quality of relationship. And so a listener who's listening to this podcast says, how do I improve the quality of my relationship? Or how do I attend to all the things that Wayne just mentioned and still arrive on the other side of this feeling really fulfilled in my life? Do you have one or two or three concrete suggestions that could be helpful?
Yeah, I hope they're helpful. I have one or two or three concrete suggestions that I trade upon. But I make my living based on these.
Yeah, I got it.
It's a humbling process to witness, to be, what happens when you're a coach or a counselor or a consultant is your witness to the inner workings in the psychosocial, spiritual underbelly of life in medicine. And I tell you, man, it's humbling. And let me emphasize, it's inspirational. And sometimes ultimately it's inspirational to me to how you docs keep on going and you medical fields keep on going. It's a study. And one of my concepts, heroes create safe spaces for other people. And Mary and I developed that sentence when writing a book many years ago about medical families. You are heroic people, unsung heroes. And this is not hyperbole based on COVID. Let's have picket lines with the banner saying they're heroes. We've been talking about that for over 30 years, in meaning sincerely. On the other hand, it's like watching a Greek tragedy sometimes, where such well-intended people working at cross purposes, not just within families, but within medical groups. We've normalized, don't talk to each other, write each other up, well-intended hospital administrators stand awake at night trying to figure out what to do to find more resources. I mean, they're not bad. I'm not talking about they're bad people, but the 1, 2, 3 things we can do is, number one, accept that we're not going to have sustained well-being for physicians until we have sustained those concentric circles, until we have sustained well-being in medical families. And personal well-being is largely a function of contagion. Duke has research that has shown if we study parameters for health professionals, how much sleep you get, how do you eat, manage alcohol, get exercise, all those things. The biggest predictor of your well-being behaviors will be the collective profile of the well-being behaviors of the people with whom you work. Our emotions, our attitudes, and our behaviors are contagious. And we've normalized I've said this for a long time, from a biopsychosocial spiritual standpoint, relative to physician well-being, we have normalized deviancy for decades. I get about as much sleep as all my colleagues. Yeah, they're all sleep deprived. I overstated to make a point.
Right.
Too much. But no, I don't work too much. Where else in America can you work all day, be on call all night, work all day the next day? You can't drive a cab doing that, much less do heart surgery doing it. But you can. We normalize deviancy. So we do have the mission to keep having this conversation, to create workplaces that are such that it makes the work more doable. That's one wing of this fictitious burden. And we got to never stop saying you've got to end institutional bullying. We have created systems and processes that are overcorrections oftentimes from, let's talk about disruptive behavior. The old Wild West days, I used to work with some groups that had 300 blatant incident reports filed against for physical abuse, sexual abuse, harassment with no consequences. Well, the pendulum has swung in the other direction, where physicians are being assumed guilty until proven innocent in many health systems. We can write them up as a good defense, trying to drive accountability appropriately so. And, that made me uncomfortable. I write you up. Next thing you know, the physician's in trouble. And I see it happening all the time. Well, the pendulum's got to level off. We got to make the RVU targets attainable. Nobody wants to be told you didn't earn your bonus this year, for God's sake, when you're still working harder than 98% of people in this country. We got to clean up the workplace. Now, gets directly to your point. In the meantime, and this is a phrase I use all the time in my coaching, Look, even if they're 90% of the problem, what 10% are you willing to own? That's our resilience challenge in my work. Because my observation is no physician works in a perfectly harmonious setting that is totally resourced, nor do they live in a perfectly harmonious family. There are no perfect people, so there are no perfect relationships. Yet, so many of the physicians we work with are thriving. Many are struggling in not thriving, they're diving. But the ones who are thriving, we conceptualize, respond to that resilience challenge, even if they're 90% of the problem. And I hope they will change. The regulators will regulate less. The bean counters will unleash some money. And so in the meantime, what's my 10%? Well, your 10% is to respond to what I call the resilience paradox. We learned this studying heart patients and cancer patients who get through the initial shock of 70% get depressed, anxious, angry, socially isolated, start having family tensions. But if you study them long term, within 18 to 36 months, almost 70% say in a strange way, those that survive, a strange way, that diagnosis helped heal my life. I now take back. Now, if you study what they do, they drop back to the fundamentals of mind, body, spiritual, and relationship health. So the resilience paradox is now that it's this complicated, and I think you've made the case, it's more complex for physicians and medical families today than ever before. Now that it's this complicated, you damn sure better pay attention to the fundamentals. And this gets to the point. If you study the physicians who say, I still love my career, despite the challenges, I have a good family life, if not wonderful family life. If I had to do all over again, I would do it again. I'm filled with gratitude. What they do is counter daily hassles with daily uplifts, intentionally and methodically. Now, our way of getting to that is to encourage people to practice mindfully the 4 Ps, I call it. With routine, build in rituals, whether it's between texts or waiting for the elevator or driving to work or driving home from work, whatever, you give it some demarcation. Pause, process. How did that just go? Saying goodbye to my family or having that meeting or dealing with that patient or writing that email. Pause, process, plan how you want the next step to go in today's journey and proceed with intention. It's one of the reasons I'm convinced that Colin West published this wonderful kind of meta-analysis of the burnout research. The very few evidence-based approaches that have shown efficacy in ameliorating physician burnout. One of those is mindfulness-based meditation. And it's not stand on your head type meditation. It's developing little rituals that allow you to pause, in our terminology, pause, process, plan what's going to happen next, and proceed with intention. And then the magic thing you want to do, whether it's as a leader or as a family member or as a practicing physician or as a person, I want to be intentional about noticing the uplifts, the things that bring you joy or give me a sense of gratitude or inspiration. Or Barbara Fredrickson's work is eloquent in this regard in terms of the evidence-based uplifts. That if we keep accumulating uplifts, if we repopulate the goodwill bank account and our energy bank account, that allows us then to withstand some withdrawals, because the withdrawals are inevitable.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment. But right now, I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview.
Wayne, I wanted to share with you, I've quoted you often with seriously, when I do workshops in well-being, I talk about owning your 10%, and not being so helpless about that. And you just gave a lot of guidance about what that can mean for people who don't really know, what does that mean for me to reclaim me? And I wondered, though, it's also your 4 Ps are the antidote, as I'm listening to you, to healthcare professionals who get on a treadmill some time ago and they don't really know, they don't have the insight for how do I get off of this treadmill? I'm just going from patient to patient to patient to patient without pausing, without processing. I'm just on the treadmill.
Yeah.
And the question that came up for me as I was listening to you is, do you have some thoughts about some first steps for people who are on that treadmill to realize that there is another way? And then also, first step, how do I get off of that? How do I take a little, dip my toe in the water of the 4 Ps? Because some people just feel really stuck on that treadmill.
I tell you, that's a great point in observation, Dale. It feels of survival significance inevitably during at least some stages of life's journey to get on that treadmill and keep your head down and keep plowing forward. Now, that may be how we get through medical training. It's always related to the old Gabhart and Menninger notion from decades ago. Physicians live in a wait until mentality. I'm going to wait until I finish medical school, then I'm going to start exercising. I'm going to wait until I pay off my medical debt, and then I'm going to feel sick. I'm going to wait until I pass my boards. I'm going to wait until we raise the kids, and I'm going to wait until I die and go to heaven, then I'm going to enjoy my life. It's the illogical extension of that. So in our coaching is really interesting. I think that we think in terms of upside down pyramids. The broad concepts are very important to grasp hold of, and then work your way down to the apex of the pyramid, which is some behavior or some controllable thought process that is actionable. And one of the broad concepts is the treadmill is never going to stop. And you can learn it now or you can learn it later, but in all probability, you're going to learn it, which is we got to unlearn some of the stuff we learned, particularly for physicians. And I think there's some unique challenges to coaching physicians because you get so brutalized in your training, even in our day of supposedly humanizing medical training. Big joke. They only work 80 hours a week. That's 2 full-time friggin' jobs in America, for God's sake. And bear in mind that most people who work 40 hours in America actually only do about 8 hours or 10 hours of work a week. They sort around the rest of the time. And you go to New Zealand, I saw a study last year. In New Zealand, the people get paid 40 hours. They actually only work 4 hours a week, and they screw around the rest of the time. Now, don't anybody send me any emails. I'm not interested in your emails about that fact. I didn't do that research, but I keep saying it. You can do it now. You can do it later. And I tell people tales like this. I don't want you to be like this guy who contacted me. I can tell you 1,000 of these. He said, my life is so much better now. I've been through 4 medical groups and I've been through 3 marriages. And finally, my life is better. I enjoy my life day to day. I like the group I work in. I like my marriage. Pause. But what's true is I'm a lot better now too. And I look back on all the collateral damage that came from my way of being in my first, second, and third group I was in, and in my first two marriages. I wonder how those marriages, any one of those marriages, or any one of those groups would have been if I had been then the way I am now. So the broad part of the pyramid, upside down pyramid, you got to get the right concepts in place, the right philosophies in place. It is not true that most physicians in America are pissed off and miserable. It is not true that everybody's burning out. We made two big mistakes in my field, and I contributed to them. And I spent the first 40 years of my career helping develop and propagate two notions I'm going to spend the rest of my career trying to correct, because we have created iatrogenic harm. The first is a mythical balanced life. There is no such thing as a balanced life. It's not about balance. It's about sequencing. And you do it regularly enough, you live a good life. You don't just stand in one arena. When you've heard me lecture, you've seen I show 4 arenas as like rocks on a screen. You can't just stand on one rock. Work, family, intimate relationship, your yoga class. You got to keep switching. The second concept that we ill-define and have created a hysteria about is burnout. Burnout is not the diagnosis of a chronic disease. Burnout is what happens when energy to cope depletes momentarily and doesn't rejuvenate with your typical recovery strategies. Only 16% of physicians are chronically burned out. Christine Maslach's research suggests a meta-analysis of the surgical literature suggests only 3% of surgeons are chronically burned out. Yet it is true 40 to 50% of us go in and out of some period.
Sure. Yeah.
And we should pay attention to that. But the broad-based concept on the top of my pyramid again is understand joy in practicing medicine is possible. Getting through a month without being pissed off is not, of course you're going to get pissed off. That doesn't mean you're miserable in your marriage or at work. We need not to overcorrect.
Yeah.
And what we need to do is keep our eye on my notion, the 4 Ps in harvesting uplifts to counter the hassles, and do it again and again and again. So I think that paying attention to, in the here and now, what is doable and manageable today, while we're contributing best we can to making changes that will help revamp the medical workplace. When I lecture, I show a 4-wing bird. There's individual physician is one wing, what they can do with mind, body, spiritual health, rethink, reframe, redecide. Second wing is you got to have medical families that are honored and embraced by the organizations. Third wing in my fictitious bird is you've got to have medical communities in health systems that make the work doable. And then fourth wing on that bird is, and it's interesting how often I hear this one from physicians when they ask, what can your leaders do to help ease some of your struggles? We really need a cultural transformation of understanding a physician's role. And one health system in which I consult said, when I did a culture assessment of medical staff, they said, what the leaders here could do that would help us best is educate this community as to what to expect when they come in the hospital. Because our patients get angry with us that we don't follow them when they're in the hospital. They need to understand what hospital medicine is. They need to understand why they're only going to be in the hospital briefly. And we have accountable care. We tend to skip over the part of that has to do with what are the patient's measures of accountability, particularly important in light of increased atrocities of health professionals being against in these post-COVID times when we've politicized so much that it's class varying letters felony to acts of aggression toward physicians or medical staff in inpatient, outpatient. I mean, who would have thought we would have come to this? This is one
right.
thing.
Well, Wayne, you answered a lot of the questions that I had prepared just in your description of your pathway, and also what can be your read on what's going on in healthcare, the individuals that are the actors in the healthcare systems, the impact that has on their system, on the family. And then also some nice antidotes for us to be thinking about, knowing that it'll never be perfect, but also refreshing to hear that we may have over-interpreted dissatisfaction as burnout.
Yeah.
That not everybody's burnt out, that there are a lot of people who are really satisfied with what they do, and they found a way to make it satisfactory for themselves. And some of those qualities that you talked about, so that they sustain.
I would insert here, Dale, please, listeners, hear this. As the backdrop of what I'm getting ready to say, which is going to sound heretical in some ways, I don't know how you do it. I think it is such a hard workplace, healthcare is. And I harken back to Peter Drucker, who invented leadership development. Dr. Drucker famously said, healthcare organizations are the most complex form of human organization we have ever attempted to manage or have studied. Peter Drucker said that in 1993. You can imagine what he would say now. And so I say with compassion to healthcare administrators, to physician leaders, to everyone, it is a hard nut to crack. And thank you for your efforts in that regard. If I think about this from the perspective of post-trauma growth, people go through trauma with capital T, and many physicians we work with have been blatantly traumatized. One of our daughters, Judy Orlando, specializes in her practice in Davidson in working with people to recover from hard times, basically. And she calls it small T trauma. She thinks every health professional is traumatized. Because if you just think about, compared to the natural human experience, I've never seen anybody die. I'm never on call. This is me. I'm never on call. I can't remember any family celebrations I missed because I was working 14 hours that day. I'm overstating it there to make the point. But you just keep on. And when the vicarious traumatization or actual trauma happens, so you just keep going and keep going. I've never been humiliated, blamed, shamed in the course of my training, and on and on and on. So it's very important, I think, to recognize, and I encourage physicians to think of yourselves as elite performers who need to intelligently incorporate the stuff we know about sustaining high performance from elite performers. The Navy SEALs are now incorporating a whole suite of mind, body, self-care, self-compassion, empathy training we know you're an animal, you can swim in the ocean and we can, shoot you and the bullets bounce off or whatever it is they do to them. But we want you to sustain, and that means manage yourself like an elite athlete learns to manage themselves. So one of the punchlines that we say, look, the cavalry ain't coming, man. There is no warehouse full of new nurses and new grads and new administrators who really get it, and they're all going to show up and revolutionize the workplace so you can stop being pissed off. In the meantime, hopefully that'll happen. But in the meantime, do you want to be one of that cohort who says, you know what, I still like what I do? And therefore, the reason this is important, let me just add as a big punchline, is our research is really, really clear. The biggest predictor of physician well-being is quality of relationships. The biggest predictor of physician career satisfaction is not paperwork, it's not epic, it's not pay, it's do I enjoy working with the people I'm working with? The biggest predictor of whether or not your life mate or your family at home are going to like you at the end of a work day is not how much you work, it's your mood when you come home from work. And the biggest predictor of your mood when you come home from work goes back to, did you get along with or not get along with the people you work with? And if you come home in a lousy mood, you spread it at home, your loved ones take an attitude against your work, which shapes your attitude toward your work negatively, and the downward spiral continues. You want to be one of those people, or you want to be one of the people who says, look, this is another day in my life. The work I do is noble and meaningful and purposeful. I often say to physicians, on your worst days, you work in miracle zones, doing the work of heroes. And I'm not romanticizing. I want you to get another interpreter in your clinic. I want you to get that broken EKG machine fixed I want you to do all that stuff. But still, compared to all the people in the history of the human race, the work you do is more noble and more meaningful, I would propose. I actually think that's This is in answer to an asked question. What makes you successful in working with physicians as a coach? I think that is really, really important to have to the depths of your DNA admiration of physicians. I'm going to tell you one of the things that has happened in the last 40 years, Dale, that bothers me. There's a whole lot of burnt out, disillusioned physicians get some kind of coaching certification and spreading their venom. And I think they do a lot of harm. I know the current company that doesn't apply to you, my friend. I've known you too long to know that. You're passionate, compassionate. You're a magnificent physician, a magnificent leader, and you're a magnificent coach and podcaster. But we got to be cautious about that. That if you're going to be an effective influencer for physicians, you got to pass the litmus test of number one, to your DNA, you admire physicians and understand the unique complexity of what physicians do. Now, the other piece of the litmus test is you got to know what the hell you're doing. It's not and I think physicians figure this out in a nanosecond. Number one, do you understand that what I do is uniquely complicated? You don't have to adore me, just understand it's uniquely complicated. And then number two, whether you're a plumber or a clinical psychologist or a coach or an administrator, you know what the hell you're doing. Because physicians are wonderfully, wonderfully rewarding to work with if you know what you're doing. You don't have to do magic. You just have to be competent.
Yeah. Wayne, I think you have, in the last few minutes, summarized so well the things that we all need to be thinking about as we are trying to become fulfilled, whole beings in whatever we do, whether you're a healthcare professional or not. And then also some really good words of wisdom for those of us who are trying to help our healthcare professional colleagues. I think you really summarized it so well. But before we go, is there anything else? I just want you to be able to have the last word. Is there anything else that has not come up in our conversation that you feel is important to share about your own discovery through your professional trajectory that you wish to have other people be aware of?
You know, I'm like everybody. I think the older I get, the less I seem to know. You know, I look back on notes from lectures I gave many decades ago. It's like, I was so much more certain about everything. And the older we get, the more I think we realize there are a lot of different paths up the mountain. And the less aware you are of the multiple ways people can achieve well-being, the more convinced you are the one you know something about is the only way to go. And so I'm humbled by the diversity that I witness. I mean, sometimes the stories I hear from groups, organizations, whole health systems, and individual physicians or medical families, no matter where we want to draw that circle. The stories I hear, the tales that I witness, the journeys that I witness of going through incredibly difficult times, but in the midst of that, finding grace and purpose and joining together in some new ways that always results from rethinking and reframing. The more stress we get, the more self-focus we get, the more called up short by things like pandemics or the sale of the group or the divorce or my diagnosis. What do you mean I've got the diagnosis now? The more people tend to get humble and open-hearted and open-minded. And that's where the inspiration happens. People drop back to the fundamentals and are more generous and gracious to each other. I wish for us, if I could give one gift, as our friend Mary Hall told me one time. Mary's a wonderful physician leader. She's very charismatic and extroverted. She told me one December, I said, Mary, well, happy holidays. She said, I'm going to tell you my New Year's resolution. I said, what? And I've told Mary, I tell this story all the time. I give her credit. This is the best New Year's resolution I've ever heard. Mary said, my New Year's resolution is I'm going to get nice sooner. She said, I always get nice eventually, but sometimes I'm not real nice at first. I love that. And if I give the world one gift, let's just get nice sooner. Let's be more generous and gracious to each other and to ourselves. I mean, we all have our enduring vulnerabilities and learn to be kind and gracious and forgiving and accepting. That is what people who go through post-trauma growth do. Like we can make it a parody by way of dismissing it and making it sound like psychobabble. But let me tell you, Hoss, whoever's listening and doing that, when you go through the setback, tune into what you're going to be doing 18 months later. You're going to be being more generous and more gracious.
Very nice words of wisdom, Wayne. I want to just say, as we close, really on behalf of my colleagues who are physicians and other healthcare professionals, your professional life has been devoted to improving our lives. And I just want to say, on behalf of all of them, those thousands, if you hadn't heard it from others, how grateful we are for your dedication to not just improving our lives, it's our families' lives, our work colleagues' lives, and ultimately our patients' lives. Really thank you for that.
That means more to me than you can imagine. Respect and value you so much. And it's just been and continues to be an incredible honor to have so many physicians and medical families and medical organizations trust me in my group to work with them. So thank you.
Thank you for tuning in to Life-Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.